Hey, it's Jeff from UrgentResponse.net. We're going to talk about calling for help. In the chain of survival, the first two steps is recognizing an emergency and then calling for help. So when you see something is wrong, you definitely want to make sure you're safe before you approach the patient. You'll approach the patient, make sure that they're unresponsive, gently shake them. Are you okay? You are right. If you get no response, then we immediately either have someone call 911 or call 911 ourselves. If we're by ourselves with an adult patient, we call right away. If we're with a pediatric patient, infant on up through child, uh, we want to make sure that we provide skills and then call for help. Infants and children have a better chance of bouncing back than adults, so that's why when we're alone with an adult, we call first. With infants and children, we call as fast as we can. Realistically, a lot of us have our cell phones on us, so we could dial 911 with the phone on speaker and connect with the 911 service. If you're not in the United States, it's important to know what the emergency response number is for that country, so keep that in mind if you're traveling abroad. Now, when we call 911, here in the United States, they answer the call 911, where is your emergency? So location is one of the most important parts. We want to get the responding units there as quick as possible. So when you identify the location of the patient, first we're going to start out with the street address. We want to also give the city and state as well. Sometimes we live on border cities between two different states. A call, a 911 call, especially on cell phones, could jump between states. So, as crazy as it may sound, it is important to say the street address, but also the city and state as well that you're calling from. So, there's no confusion to where that call's coming from. Sometimes on cell phones, it's a little harder to locate where the cell phone call is coming from. So that's why it's even more important to confirm the street address, city, and state to where the patient is. At that point, we also want to identify maybe we're in an apartment building, what the apartment number is. Maybe we're at a facility where we want to identify, what floor the patient's on and what their room number is. Uh, Everything that we can do to get the responding units to the patient as quick as possible. So in some big industrial settings, there may be multiple buildings. Sometimes the best thing is that an escort is sent to the entrance to escort the responding units right to the patient so they can get there as quick as possible. So whatever we can do to identify that location for the response. If you're at home and it's nighttime, it's hard to see uh, home numbers and that, like as far as the address. So if it's the middle of the night and we turn on all the lights in the house, that just makes that home more visible for those responding units. Or if there's extra people, somebody can come out and wave down the ambulance so that we can get to that patient as quick as possible. So location's very important. After that, we also want to tell the 911 dispatcher, a callback phone number. They're going to want a callback phone number just to confirm that if they get disconnected from you, that they can call you right back. They may have your number on a screen, but again, they should really confirm that information. Sometimes people have business cell phones, those cell phone numbers that identify, a lot of times according to billing information, so it may not be really the number you're calling from. It could be that there's an office number that's attached to. So we just want to make sure we confirm that if we get disconnected and we call the number we see on the screen, that's going to go direct to you where you're by the patient and you can give us the most accurate information on what's going on scene. So another important thing is the age of the patient. How old is the patient? We want to show up with the right equipment. So a lot of times, if it's a pediatric patient, there's different size equipment, medications are different. So it's important to know whether it's an infant birth to one, a child one to puberty, or an adult puberty on up, so that we show up with the right size equipment. So keep that in mind as well, that we want to know the age of the patient, and then we can get into, what's wrong with that patient. So maybe I have a 90-year-old patient that has fallen, so I've identified that they've fallen. They're maybe still on the floor. Did they lose consciousness or not? Did they sustain any injuries? As much as you can tell us about what's going on scene, but also what's being done. So maybe it's a cardiac arrest. And we have people doing CPR. We did have an automated external defibrillator on scene. It's being utilized. Or we've shocked the patient twice, no results. We're still doing CPR. Again, just tell us what's going on scene. You don't have to use big medical terms or anything like that. Just tell us, what's wrong and what's happening as far as the treatment of the patient. We want to get as much of that information as we can, get it so we can prepare as we respond to this emergency, so we have all the proper stuff as far as treating the patient. So again, recognize that there's an emergency. First of all, and most important, make sure you're safe before you approach the patient. Check for responsiveness. If there's no response, or even if there is response, then we should have somebody call 911. A lot of times we also add call 911 and grab the AED. So that may be two different people. So somebody can call for help. Somebody else can get the automated external defibrillator, especially if it's an unresponsive patient, possibly a cardiac arrest. Do that. Then we're going to identify the location once we've dialed 911. And then we're going to identify a callback phone number, the age of the patient, what's wrong, and what's being done for that patient. Now, it could be a domestic violence situation, or maybe you're unable to talk. Here in Massachusetts and a lot of other states, they do allow text 911. You could, in the phone number section, put 911. In the body of the text, put all that information we talked about. It is much easier to make a voice call, and it's highly recommended that if you can make a voice call, you do that. Those calls are easier to transfer information, or even just transfer the call to the responding department. So we want to make sure that we make a voice call over a text call. And there's also other options too when calling for help. Maybe there's a language barrier. A lot of the 911 centers have quick access to interpreters, so they can interpret the call to get all the appropriate information.
If you enjoyed this session, please click on the subscribe button. If you would like to take a CPR first aid course with me, then you can direct message me or email me at jeff@urgentresponse.net.